Hi, Samantha. Thank you both for offering all your expertise. Will patients with neurogenic TOS exhibit color and temperature changes in the hand and arm? That's a good one.
So the short answer is not usually. And the long answer is if they've developed this complex regional pain syndrome, if they have developed a chronic irritation that involves the sympathetic nervous system, you can get something like that. But more often than not, it's either a vascular A or V TOS, or it may be actually a sympathetic dysfunction, and it may involve whether it be hyperhidrosis or other symptoms that involve inappropriate sympathetic stimulation. So or you can have both. So we like to call it.
What's the idiopathic syndrome where the hand changes color, pallor, cyanosis, rubor? What's that called again? I'm blanking.
Well, I mean, we talk about,
I'm sorry, I'm interrupting.
Corners and other sympathetic dysfunction, but there's but anyway.
So I'm going to show you my geekiness with TOS. Władysław Ellis is a neurologist he's now in Grass Valley, California. Really bright guy. His daughter is a really good neurologist in Berkeley, Selena Ellis, one of the people we recommend. Anyway, he did a paper UCSF in the 70s with Ron Stoney and another doc whose name I'm blanking on, but they actually did thermography. They would measure the temperature of the hands while they were doing surgery, and they found a few things would actually increase the temperature in the hands. So what Art is saying is true. There's evidence that in a small percentage of patients, they do have sympathetic involvement. Sympathetic, parasympathetic are branches of the autonomic nervous system. It's an unconscious nervous system. It regulates blood pressure, the temperature, hyperhidrosis, sweating. And there's a paper from the early 1900s that showed that a small percentage of patients actually had in their C8 and T1 nerve roots, the sympathetics were distributed unevenly off to the side and back where they could be pressed upon by cervical ribs. It's from like 1910. So in some patients, there's evidence that, yes, they do get this kind of phenomenon, color and temperature changes, and there's some evidence supporting that, which I just said twice, I think.